I'm Dylan Ratigan. I've interviewed nearly every CEO and most world leaders during the past 25 years. And now I'm bootstrapping. I'm turning my attention to the new CEOs and the irrepressible entrepreneurs leading the next generation of innovation in the world. Welcome back to Tasty Live. I am Dylan Ratigan. Time for some bootstrapping. My guest today, Lauren Bongiorno. Risley Health is the business. Diabetes is the domain. Obviously, one of the biggest, if not the biggest, health crisis in the United States, and certainly globally. I mean, it's one of the major costs, and more important than cost, sort of life impairments, whether it's on life's quality of life, life duration, all the symptoms and consequences of diabetes. So what is Risley Health doing to address this massive healthcare issue?
So Dylan, most people are most familiar with type 2 diabetes. Type 2 diabetes is a metabolic disorder, essentially, where the body becomes resistant to insulin or doesn't produce enough insulin, very much related to lifestyle factors that can cause it for somebody. At Risley, we are supporting mostly type 1 diabetes for now. Expansion plans, that's a different story. But with type 1 diabetes, it's actually an autoimmune condition where the body attacks and destroys all the insulin-producing cells in your body. And so you're predisposed to it. Something kicks it off. For example, a lot of people in the pandemic who got COVID, it was followed by a whole sort of thousands of people getting diagnosed with type 1 diabetes when their immune system attacked. So we know that most people with type 1 diabetes, especially in the United States, are not getting the support that they need in a typical 15-minute doctor's appointment. We see our doctor once every 3 to 6 months. And so we built a virtual health coaching model and programs that have helped really thousands of people reclaim the life that they deserve.
So when you said a virtual health coaching model, did I hear that correctly?
Yeah.
So that obviously triggers a litany of questions. The first of which would be, what is the essential content of the coaching? I forget what virtual means and what coaching means. What is the content of the coaching that you are attempting to communicate to type 1 diabetes patients?
Yeah, so it's a great question. It's actually one of the reasons why a lot of people years ago, when I started this, had said, are you sure you don't want to go to medical school? Are you sure you don't want to, become a nurse or a certified diabetes educator and working within the hospitals and within the clinics? And kind of what I said was, there's enough of those, and it's not working because the healthcare system isn't allowing them the time to really sit with patients to be able to understand what their blocks are, their mindsets, their habits, their behaviors. And so we have a team of 10 board certified health coaches. And essentially what we're helping people do is hold their hands from where they are now to where they want to be. So that's both in numbers. So A1C and blood sugar is improving those, but also in just their overall quality of life metrics in terms of their.
But so let's say I'm a patient, like you're telling me what I should eat. You're telling me how much I should sleep. Like, what information are you coaching? What are you telling me?
So we have both group coaching programs and one-on-one programs, and we're essentially meeting with people and saying, okay, let's understand, let's look at your sleep, let's look at exercise, let's look at your mindset, your relationship to diabetes, your relationship to food, and really helping them understand where those blocks exist that are not allowing them to get the outcomes to make them feel the best they possibly can.
Phase one is an assessment of what exists. How much do you sleep? What do you eat? What's your current reality is phase one.
Right. Yeah. Why are you coming here and why are you struggling?
And then your coaches, how many coaches do you have?
So we have 10 coaches on our team. What's unique about Risley is every coach lives with type 1 diabetes themselves. So it has that relatability factor that we have been in your shoes. We get it. We understand most people are feeling either lost or just stuck in a cycle of frustration. And there's a level of just trust that automatically happens from the start in the program.
And how many patients can one coach?
So right now we have, as I mentioned, group coaching and one-on-one. Our group coaching, we do 4 times a year. It has 45 people in the program. And then we also have, each coach has anywhere from 10 to 20 clients that they serve.
So in order for the business to grow, you would need to add coaches, I presume. Like right. That growth path for the business is adding coaches.
Right, which is not necessarily where we're headed and where we're going. It's brought us to where we are today, but we're at the point where we're kind of looking at Risely 2.0 right now and assessing what for scalability is going to allow us to be able to access more patients. I mean, you have 64,000 people that are diagnosed just in the US per year. And so that is our next step beyond the programs that we serve, which is very much concierge coaching. How are we going to be supporting as many people as possible?
Is it something that AI, could you basically make an AI version of your existing coaches and scale it that way? I'm sure you've done a lot of
So it's
spitballing around this, but
it's a great question, and AI is obviously like a hot topic right now. AI would never be able to replace what we're doing essentially, like at the level and the depth that we are. However, as we move into exploring different tech opportunities with some partners, it is something we are exploring because at the end of the day, we just have to keep type 1 diabetes and their blood sugars front of mind for people. And so if we could have a AI type 1 diabetes coach that is modeled off of essentially our programs, helping just give those basic reminders on a day-to-day basis. Oh, hey, pattern recognition. We recognize your blood sugars are 10% increased time in range when you walk this many steps a day, or when your sleep is this. So really kind of looking at data aggregation from all the tech and wearable tech that people have access to, and then connecting it to blood sugars and helping people identify their patterns.
and as when you talk about the patterns, if you were to look at the coaching experience and the client, the patient experience,
Mhm.
are there two or three specific behaviors or blocks or sort of patterns that are consistent with people that you see, where it doesn't matter if it's whoever the patient is, you're like, most patients with this thing or that thing is, if you, or like two or three major things that you can change, and you're like, oh, most people have this type, these are the big three blocks. Of the big three blocks,
Right.
these two are almost intractable, so don't bother. But this one is actually the one that can be most influenced. So I'm just kind of interested in what are the big blocks, and also where can you actually have the most influence, as opposed to maybe there's some big blocks where you honestly, people
Yeah.
are not going to change.
So why type 1 diabetes is such a hard condition and disease to live with is because on average, there are 42 plus different factors that impact your blood sugar on any given day. Just from like the humidity outside can be one of those factors as an example that an average person would never think about, right? You think about food and exercise as the two, there's 40 others. And then on average, we make 180 extra decisions than and just an average person on a daily basis. And so when you talk about pattern recognition, it's looking at what are the patterns that are creating you, or what are the gaps essentially that are not allowing you to be able to make those decisions more confidently or understand how to pull all those different factors in for your body. So for those three blocks, I would say, Dylan, number one, it's education gaps. The healthcare system really, they kind of, teach you what they do in a day at the hospital when you're diagnosed. And then the rest of it is, for you to kind of figure out. And there's not a standardization that happens as well. You could hear one thing from one doctor, like, don't eat condiments, stay away from ketchup, additives. And the other person could be like that. The doctor can say, that's ridiculous, stay away from this. So there's no standardization, and that's problematic. Number two, it's mindset blocks in the sense of perfection, right? You can never be perfect with diabetes, but you take somebody who's a perfectionist and they're going to say, I just, I don't even want to try because I know I can't be perfect at this. Or somebody who's an avoidant personality, right? I don't really, want to even accept the fact that I have diabetes. So that's number two. And the number three is the feeling of isolation. Type 1 is an invisible disease. You look at me right now, you wouldn't know that I have it. I've been living with it since I was 7 years old. And so you go on throughout life unless you're communicating to others that you have it, you feel very alone in it. And so that's how the community and the group coaching, in our programs really support people in finding that sense of I'm not alone in this.
And then how do you measure like this? If you were to come in and say, I want to demonstrate that this is successful, that this is effective.
Yep.
And I had these patients and I started coaching them and they were in this situation. And now it's been a year or 2 years. And now the same patients on average are in this situation. What
Yes.
what are the metrics that you would use to illustrate effectiveness? Is it the mental condition? Is it the biological condition? I'm interested in
Yep.
how you measure your influence.
It's two things. Number one, we track both A1C, which is the main
That's like
marker.
your number. That's like the
Exactly, the
speedometer.
number. Just to give you, if you don't know this, Dylan, it's important. Only 27, a 7A1C is the marker that research has showed reduces health complications, from neuropathy, kidney disease, all of that. So you want to be below a 7. Right
Okay.
now, only 21% of people with diabetes in the US have an A1C below 7. To me, the healthcare system is failing 79% of our population and community. That being said, we track A1C before and after program and also a year after people leave the program to show sustainability. And we also show increase in their blood sugar time and range. So you want to be between a range of 80 and 180, and you want to be about 75% within that time frame. And we show and we track that. That's quantitatively. Secondly, qualitatively, we track on a Likert scale of 0 through 10 before and after the program. Where are you in terms of your relationship to diabetes, your diabetes education, your sleep, your self-acceptance and love, your, relationships in your life, all of these other areas that, we want to show improvements in. So in 2021, Georgetown medical students did a study and they found that 68.7% of people leave our programs with an A1C below 7, which tells us we're tripling the national average. And on average, on the Likert scale of qualitative, improvements, everybody increases on average 3 points. So that's the data that we have to share.
Mm-hmm. So what of this, you said it's 79% that are above the 7, just to come back to the initial, the quantitative piece. Of that 79%, what percentage of them could be below a 7 were they to have different inputs, whether that's exercise, sleep, humidity, whatever the 42, like how many of those people could I manipulate the 42 variables such that they would be below a 7? All of them?
I think I would say at least half of them. I mean, we're showing that we can triple that average, so at least tripling it. But I would think that there are some people who, of course, are resistant to any help. They don't want to help themselves. And
no, but I'm saying, but I'm not forget the personality issues. I'm saying biologically, what percentage of those people could be, if I change what they ate, slept, exercised, what the humidity was, if I have your list of 42 things, and I was able to force a human being to do the right things on those 42 things, could all of those people be below a 7? Like, is the only reason they're not below a 7 behavioral? Or is it some of it, even if they had perfect behavior, biologically, it's impossible? That's a kind of my question.
But I don't know. Biologically, it's definitely not impossible. It can be done. You also bring up a great addition, which is accessibility in the US, right? Insulin is the 6th most expensive liquid in the US. You have that challenge where people don't even have access. They're rationing their insulin. You also have people not having accessibility to technology, continuous glucose monitors, insulin pumps. So I would say that
there's no biological barrier to everybody being below a 7.
No, not biologically.
Behavioral and it's
behavioral
access,
and accessibility.
resource access and behavior.
Correct.
So theoretically, everybody could be okay, even with diabetes, if they had the right behavior and they had the right resource access, which I'm obviously is never going to happen. But I'm just trying to understand the nature of why the problem exists.
Right. The reason it exists is because it's a complex disease. I think a lot of diseases and conditions, you say, here's the pill, take it, right? And then it's just the mostly like acceptance of living with it, but like you know what to do. It's take the pill or don't take the pill. For diabetes, there's, once again, literally, I've probably made, it's midday right now, 12 o'clock, I've made at least 30 different decisions that influence my blood sugars. And most people don't have the support, the education in order to be able to make those informed decisions.
Right. And it's that exact complexity that then makes the value of something like your coaching, I would imagine, so high.
Exactly. Right? Because there's no way that you're right. There's no way you cannot. The healthcare system, it's not that the providers don't want to, but they have to hit a quota of hitting X amount of people within a day. And you just don't have time for that kind of back and forth.
So let's go to our list of 42 behavioral or environmental factors, or just whatever they are, factors. Of those 42 factors, is there some number of them, 4 of them, 5 of them, 10 of them, that are disproportionately influential, or are they all equal influence?
They're all equal influence, I would say. I would say most heavily, obviously, nutrition, but within nutrition, right? It's not just, eat healthy carbs and don't eat healthy carbs, right? It's the quality of the food. It's the quantity of how much you're eating. It's the ratio of carbs, fat to protein on your plate. It's when you give insulin, are you going to give it at the beginning of the meal, the middle of the meal, the end of the meal?
Timing is one of the factors.
Blood sugar, timing is a factor. So it kind of breaks down into, the minutia is important. I would say
so
nutrition.
I'm going to ask a ridiculous question. Let me ask you a ridiculous question. Just indulge me. Let's say I wanted to eat whatever I want, whenever I want, and I wanted to sleep as little or as much as I want.
Mm-hmm.
I'm like, okay, those are only two factors. There's 40 other factors. So I'm
Mm-hmm.
going to make the other 40 factors perfect,
Mm-hmm.
exactly what the doctor would want. I'm going to stay in the perfect humidity. I'm going to stay in the perfect, I'll drive my car at the right speed. I'll have the right stress level, whatever the other 40 factors are, I'll make them perfect. Can I
Right.
make the other 40 factors perfect in a way that allows me to eat whatever I want? I'm assuming obviously not.
No, you're right. And I guess I
So
would say
food
that
must
the
be the most
foundation,
important thing.
the three kind of areas that I would look at foundationally would be your hormones, your nutrition, and your exercise and movement. Those you can't, like everything else you can build on top of it, but those you have to kind of look at
Like you
first.
have to, the foundation is your food, your hormones, which is a
Mhm.
level both manipulated manually, shots and whatever, but
Mhm.
also that's why
Well,
it
not
goes,
so right, and not so much shots in that sense, but hormonal cycles. So think about your when cortisol is peaking during the day, when
or
your sleep
serotonin.
is serotonin, when your sleep is deprived, what that does to your hunger cues the next day. Sleep debt increases your hunger by 32%. So if you're trying to, eat a certain, diet that's supportive of your blood sugars, it's gonna be harder to do if you're sleeping or you're working a high stress environment where you're not getting that consistency.
Got it. So basically, like if we like to get started, we got to get the sleep level, we got to get the hormones level, and we got to get nutrition in some boundaries of some kind.
Right.
As an
But
then
Right. But Dylan, I think the problem is in what we see and think about like New York Times bestselling authors in terms of diabetes is everything is set to the extreme. It's like high carb, low fat or keto diet. And there can definitely be a balance. It doesn't have to be foundational support for your diabetes looks like cutting out all refined sugars or never eating pizza, never eating a donut, we don't believe in that because I don't think that's sustainable. And there's a way to do it and have that healthy A1C and feel good when you know how to manage those more challenging foods.
yeah. Okay, so let's go through the ruthless and cruel financial lens, shall we? Diabetes is one of the most brutally expensive and horrible components of the American healthcare infrastructure.
Mhm.
Crushing. The reason our health insurance premium, one of the reasons our health insurance premiums are, I mean, I won't go through the list of horrors, financial horrors, which is obviously secondary to human horrors, right? But, and you're telling me you can triple, if I heard you correctly, the percentage of customers or clients or patients
Yep,
that are below a seven. Is that right?
correct.
And I'm assuming the more people that are below a seven, the lower my diabetic funding costs are if I'm a United Healthcare or Cigna or whatever,
Absolutely. Absolutely.
right?
100%.
So and I like making money because I'm a health insurance company, right? So so my goal would be to charge the highest possible health insurance premium and pay as little as possible for healthcare, right? I want to, and so if you can help me reduce the amount of money I have to spend doing diabetes reimbursements because you coach people into a lower cost profile as a patient, I would
Mhm.
think that what you're doing would be spectacularly interesting to the health insurance companies. Is that true or false?
Very true and very spot on. And
And
it's
so is that who pays you at
no,
the end of the
so right now there's only two insurers that will cover and reimburse about 15, anywhere from 15 to about 45% of the program. And it's about, let's say, 20% of people who come through our programs. The rest of the insurance companies will not cover it yet. This has been something that not only we have been fighting for many years, but also the National Board of Health and Wellness Coaches have been fighting for because the evidence is there that it is helpful. There's just so much red tape in the healthcare system that really only the nurses and specialists, really providers, is what is getting
they
covered.
like to reimburse for
And
procedures. They don't like to
right.
preventative in general, especially outpatient preventive.
Exactly. We're on the outskirts right now, but I do see a future where coaching will be covered. And with the new initiatives and partnerships that we are looking into doing in terms of the tech space, we've already had insurance companies share if this tech can increase somebody's time in range by 10%, we would be interested in covering it for all of the people on our plan. So we're getting there and we're trying to find ways around the traditional kind of red lines that happen.
You and everybody else who cares about human health.
Yes.
The health insurance companies are Satan incarnate, but I'll save that for a different discussion. And I personal
We can
opinion.
talk offline.
So what is the greatest sort of like, what is your ambition right now? Like you talk like what, like, obviously I'm assuming you would like to have more diabetes patients, have more access to more coaching to get more people below into a healthier condition as a sort of clear intention for Risley Health.
Mhm.
What are some of the next steps in that path?
Yeah, so the next steps, like I had shared earlier, really is most likely not only going into the tech space to access more people with, on a subscription-based level that is more of the like, $9.99 to $19.99, plan. However, we are also looking at expanding through partnering with nonprofits, potentially playing around with, different structures of Risley to allow us to bring in more scholarships for people who can't necessarily afford coaching and that extra out of their network support. So it's really to your point, getting this in the hands of more people to support them in the way that they deserve to be supported. And then also beyond that, I mean, it's big, Dylan. Like the vision is to be able to, bridge together also research and the just create more of a
More
holistic,
resources, sure.
right, more resources for
But
people
why
to.
not 100 coaches? Like, why not just 100 coaches, 200 coaches, 2,000 coaches? Like, why not just add coaches?
Yeah, so I think the problem with that is really a pay for services model is really hard to scale. We are a bootstrapped company. We have been from day one. And we've gotten to where we are today, but what has brought us here today is not what's going to.
But if we got you into a big health insurance reimbursement from United Healthcare, then you could add coaches for miles. So basically, you're not going to run a budget off of your company to add coaches, hoping to run billing against diabetes patients. That's not a plan. Basically, a plan
Right,
would
no,
be a budget from a health insurance company to do it.
exactly.
Yeah.
Exactly. It's like chicken or the egg and trying to get that wait it's waiting for the healthcare systems to catch up, but also not waiting for them and saying, what can we do in our power to keep growing and impacting more people?
And how can people get to you, learn about you? I'm assuming there's a website.
Yes. So we're very active. We're very active both on my social media platform, Lauren_Bongiorno, and then the Risley Health, risleyhealth.com, RISELY health.com. And then we also have a podcast, Reclaim Your Rise, where we put out episodes every Tuesday.
Cool. Lauren Bongiorno. Good morning in Italy. Um, Risley Health. I'm Dylan Ratigan. This has been Bootstrapping. More tasty live after this.